Just briefly, the objectives for today is we want to talk about what's driving the new CBCS changes. And in the communication we had sent out, we had let you know that there are some very exciting changes. So we want to let you know what's driving those changes, what are the changes, and what are the resources available to help you. So our speakers are Amy Roberts, who is the product manager for this product line, and Virginia Ferrari, and she is our content strategist. So they will be doing the presentation from here on out, and I'll be monitoring the Q&A.
Excellent. I did want to note too that Virginia is actually our resident billing and coding expert here at NHA, having worked as both a practice manager for internal medicine, and she also taught in billing and coding programs, both in the community college setting and career college setting. So we are very lucky to have her on staff here with us. So as Julie stated, I'm Amy Roberts, product manager at NHA. Good morning or afternoon, depending on where you're all located. Thank you so much for taking time out of your busy days. We are so happy that you could join us today. And so before we get started, I first wanted to give you a little bit of background and context about how NHA arrived at the changes to the new CBCS and study guide. So as most of you know, NHA is an NCCA accredited organization. So all of our certification exams are considered high stakes. This accreditation enables credentialing organizations like us to demonstrate to all of you and the profession and certificants that we serve that our program has met stringent standards and best practices in the industry. And as a business, we work to ensure that our certification accurately reflects the profession that we are serving and meets a true market need. And as we all know, those market needs change as the industry and professions evolve. So with CBCS being one of our oldest exams and having insight into some of the industry changes that have occurred since 2013, we knew that we needed to make sure that the end result was a certification that meets today's needs in the billing and coding profession. So we wanted to make sure that the certification has value to the people that are trying to find a job in this profession and the employers that hire them. So to validate what needed to be covered in our certification, we conducted extensive research to ensure our understanding of the market was correct and how we could best meet that need. This research provided guiding direction to a process that we call a job task analysis. So a JTA, a job task analysis or JTA, is a best practice process for credentialing organizations like us. Again, it ensures the certification is a current reflection of the profession. This process is used to identify in detail the particular job duties and requirements, along with the relative importance of them, the frequency and the criticality of each of those tasks. And what this research and process told us is that to adequately prepare someone for an entry-level billing and coding position, it is important that we have representation of both billing and coding, unlike many other certs out there that focus on one or the other, and some are not accredited. It's also important that we have application of coding focused on what an entry-level person would be asked to do that can have a real impact on the bottom line of a practice. And lastly, an understanding of the complete revenue cycle. And Virginia is going to go into more detail on each of these in just a second. But this process is, like I said, a best practice, and industry experts, like all of you, are extremely critical to the process. We can't do it without people like you. And an example, our steering committee, we had a family practice physician, we had a billing and coding textbook author, we had a program director over a billing and coding program. And each of these committees have a really important role, but perhaps the most important committee here is our practice analysis task force. And so meet our PATF. This group was made up of seasoned professionals, both practitioners and educators. This group was amazing. They brought years of experience, expertise, and passion to the whole process. And we couldn't be more proud of them and the final result, which is the new CBCS. So our new CBCS will meet the market need better for those billing and coding professionals that are trying to enter the space, setting them up for success in their new role. The new CBCS will serve a market need with a foundational certification that is essential for entry-level roles in various practice settings, or for those that pursue an advanced level credential. It will also validate specialized knowledge in a wide range of both billing and coding, application of coding, and an understanding of the complete revenue cycle. And as you know, this is a critical component to understanding all the financial transactions in the medical office. So that is what our certification will ensure that your folks have competency in. Now I'll hand it over to Virginia, and she's going to give you a closer look at all of the exciting changes on both the test plan and the study guide. Virginia?
Yes, thank you, Amy. And again, a welcome from me. Thank you so much for attending today. So let's talk a little bit about the current CBCS that you're familiar with, and then we'll talk about where we're headed. So for comparison, when you look at the two test plans, you'll see the changes are, number one, the number of pre-test questions, which are increasing from 20 to 25 pre-test. You'll see that there's an additional time allotted and from 2 hours to 3 hours, and that will allow for the application of coding, and that the coding manuals are required to sit for the exam. The application of coding will demonstrate proficiency in how to code, how to use the manuals to code, and why it's important. So the coding manuals that NHA will require to sit for the exam are the current year ICD-10-CM, CPT, and HCPCS coding manuals. And by current year, we mean if you sit for the exam in 2021, then you would want to use 2021 coding manuals. Although each person taking the exam will need to have a complete set of manuals with them, if your program shares manuals in the class, but then makes them available to each candidate to sit for the exam, that's fine. Just make sure they don't make any notes in the manuals directly. So now let's compare the 2013 domains to the new test plan domains. And as you know, the current test plan had 5 domains, and domain 5 was the knowledge of coding, but not the application of coding. So the new test plan outline consists of 4 domains, all of which contain aspects of the revenue cycle. And you will note that billing and coding have almost equal representation, and domain 3 is coding and coding guidelines, including that application of coding. And we all know that coding and billing, kind of go hand in hand. So we think it's really important that this focus has been on the relationship and both billing and coding. So let's take a deeper dive into each of the new domains. The revision of the CBCS exam focuses on all aspects of the revenue cycle to better prepare learners for success. As the image reflects, this begins with patient registration, then scheduling, all the way through to patient statements and collection of all fees for services rendered. We know that a billing and coding specialist has a positive impact on the revenue cycle because they understand the how and the why of accurate and timely claims processing. They relieve providers of the administrative burden of coding, and claims are paid on first pass, which results in reduced administrative time and costs. So domain 2 of the new exam covers insurance eligibility and other payer requirements. For example, we all know how important it is to have accurate demographic information, including insurance, and to perform eligibility checks. Knowledge and proficiency of these requirements is essential to services being paid on time. In addition, domain 2 covers the filing order of claims and the coordination of benefits. Domain 3 covers coding and coding guidelines. And this is really where our biggest change is, obviously, that we'll be covering the application of coding. So some things to know about this domain are that the new exam will cover common patient scenarios in an outpatient setting. There will be no inpatient and no rapidly evolving codes such as COVID-19. There will not be complex scenarios that an entry-level biller or coder would be expected to do. Any codes on the exam will be the current year codes, and the exam will be reviewed annually, and any questions that contain deleted codes will be removed and new questions and codes will be inserted. And that will happen in the background with no disruption to your program or the exam takers. And last is our domain 4, which covers billing and reimbursement. And this is an extremely important aspect of the revenue cycle and how a certified billing and coding specialist can positively impact the practice. So for example, competent medical billing and coding professionals at all levels of practice are invaluable to reducing or minimizing errors that can lead to denied claims and decreased or delayed reimbursement. Those with a CBCS certification are recognized, even in entry-level positions, for the ability to positively impact healthcare organizations by supporting accurate and timely billing and attaining that optimal and accurate reimbursement. On the next slide, you'll see an example of how accurate coding affects that revenue cycle. So this is an excellent example of risk adjust factor coding and the financial impact of complete and accurate versus incomplete coding. So in the first column, you'll see where no conditions are coded, there's that annual reserve for care of $5,418. In the second column, where someone would code just some of those conditions, that annual reserve would be $8,921. And yet in the third column, when all conditions are coded from the medical record, including manifestations and disease interaction, that annual revenue for care is now $16,573. So you can see how important that is, and it just demonstrates how important that knowledge and application of coding is to the revenue cycle and the financial health of the organization. Now, we'd like to introduce you to some of the engaging and exciting features that will be in the new CBCS study guide. So in addition to all the great features you've come to expect, we have upped the game for CBCS. New to the CBCS study guide are module introduction videos, professionalism tips videos, animated mentors, and EHR documentation simulations. Each module is introduced with a video highlighting information and concepts that will be covered. There are professionalism tips specific to billing and coding on the topics noted here on the screen, such as communication, ethics applied, customer service, prioritization, and more. Next, meet our mentors. This is Billy and Cody, and Billy and Cody will be providing valuable tips throughout the study guide, such as indicators of billing and fraud abuse, E&M codes, permitted use of disclosure of patient information, and more. So these will be throughout the study guide, and they will be popping in to help the learners understand these important concepts. We're also excited to give you a sneak peek at our EHR simulations that are related to billing and coding, the revenue cycle, and regulatory compliance. Some of the simulations will be running an operator log, entering information into patient demographics, performing an eligibility check, collecting and documenting a copay, selecting accurate ICD-10, CPT, and HCPCS codes and modifiers, entering a manual charge, such as a home health certification, transmitting claims electronically, and processing and posting payments electronically from a remittance advice. So first, a patient visit or scenario is provided, such as you see on the screen, which sets up that EHR activity. Then step-by-step instructions are provided to complete the task. So for example, here, the instructions say, click on visit charges in the practice management dashboard. And when you do click on that, it will automatically advance to the next screen. As in a live EHR, additional instructions and screens are provided to complete the additional tasks, such as selecting diagnosis codes and then saving the transaction. These EHR simulations will be in this type of format. And while I've only touched on a few of the new study guide features, we hope that you're as excited as we are. And I'll now turn it back over to Amy to talk about the practice assessments. Amy?
Yeah, so practice assessments. We've made some changes here, some really awesome changes. If you've got familiarity with some of our other professions and the practice assessments that and how they work on those professions, we're changing it up a little bit. So what we're going to do with billing and coding is you're still going to have 3 practice assessments with 2 attempts on each one, but they're going to be structured differently. And this one will start with a pretest. And this pretest is to be taken at some point. You've started your course, your coursework, and before you really get into maybe the study guide preparation part of your course, you'll introduce this pretest, and this pretest will become a baseline on each of your learners so that you can see where their knowledge level is at that point in the course. And then what that will allow you to do is that once you have that baseline on the pretest, after they've completed all their practice opportunities, you'll be able to see the effectiveness of the study guide materials and the remaining of the course preparation. So I think this is going to be an exciting change to the practice assessments, again, allowing you to get a baseline on where your learners are at and where they might need some additional focus. So there will be some remediation provided after that pretest is taken. And then a second pretest, or I'm sorry, the second practice assessment will be what we call a formative assessment. And this will work just like in the past, where you can take this after the pretest has been taken. These 2 formative assessments can be taken at any time someone feels like they want to practice and test their knowledge. This assessment will provide rationale, so they will know why an answer was wrong or right. Again, helping them through that mastery of content. And then lastly, you'll have a summative assessment. And this is a critical measure that can then be used with your final practice assessment score, or showing you a final practice assessment score that shows the overall improvement in the ability to be prepared to pass that certification exam. So this is meant to emulate that exam experience. It will be a timed assessment, just like the certification exam is. There will not be rationales provided on this. So you really want to make sure that when you assign that for your students to take, they're ready to go. It's a couple days before their certification exam appointment or whatever, just really close to that time that they're going to take the final exam. So we're really excited about the changes that we're making here to prove efficacy of preparation materials. So Virginia, you want to go through some key questions that we've been getting?
I do. Yes, so throughout the job task analysis, we've heard some key questions, and we want to take this opportunity to answer some of those for you. So first, when will the new study guide and exam be available? And the study guide and practice assessments are scheduled in June 2021, so in just a few months, and the new exam will launch in 2021. So while we don't have the exact dates yet, they have not been released, we are expecting those months to be our launch dates, and we will communicate exact launch dates as soon as they're confirmed. We've also heard some questions on what happens during the transition from old to new. Would both the study guides be available during the transition? And no, just like other certification updates, we cannot have 2 exams for the same certification. So the study guide will launch approximately 2 months before the new exam, so the learners will have a test date on or after the new exam launch date can begin to prepare for that new exam. The current study guide, the current one, will remain available for those learners with a test date before the new exam launches. And only the current exam, the one from 2013, will be available until the new exam launches. So once that new exam launches, the current exam will no longer be available. And the new exam outline and crosswalk are available on the NHA website to help guide your transition now.
Yeah, I think the only thing I'll add to that is if you've been through this exam update process with us before, you use other certifications with us, it's the exact same process. We're not doing anything differently in terms of how we transition. So if you're familiar with that and have had experience with that, it'll be the exact same process.
Great. So another question we've heard is what will happen to current CBCS certificate holders? Will they need to retake an exam? And no, they will not need to retake the exam. We'll have continuing education that is current to the CBCS certificate holders to be able to renew their certification. And NHA has updated its CE offerings with new and fresh content related to CBCS. And again, that process has not changed. So this is a list of timely, billing and coding specific continuing education that's available through NHA, along with other great CE offerings such as telehealth, social health, leadership management, communication, and more. And you will note that the CPT and ICD-10 coding updates will be released as CE in the fourth quarter of the preceding year so that the CBCS certificate holders can always stay up to date on the newest codes and guidelines. So you might also be wondering about how coding is addressed in continuing education. So in addition to the general content questions in the CE, this image will demonstrate how an example of application of coding might be presented in continuing ed without needing coding manuals for recertification. To help you with your transition from the current CBCS to the new CBCS, we have some resources for you. We have that crosswalk and exam blueprint that I mentioned before, and they're posted on the NHA website. And we have an alignment guide template coming soon that you can use to map your curriculum, and that will be available to you before the study guide launches.
All right, thank you, Virginia. So, Julie, do we have some questions in the Q&A?
Yeah, we do.
Okay.
We've got a couple of questions, so I will start. Will the exam change every year because the codes change every year?
So I can answer that one. So the exam itself, the blueprint will not change. It will remain the same. The exam will be reviewed annually, and any codes that have been deleted will be removed and replaced with new questions and codes for that current year. So once again, that'll happen in the background. That won't affect any exam takers or your program, but they will be updated every year and reviewed every year. And we're hoping also that by using some of the more common codes and scenarios that maybe we won't have those updates, but we know that they happen and they will be reviewed and updated annually.
Yeah, I think that's it's a really important question that we've heard quite a bit too. And I think the point about this happens, that any change would happen behind the scenes, and any change will still align with that test plan so that you're not having to make curriculum changes every year in the event that a code does change. But just to reiterate what Virginia said, we are kind of honing in on those code sets that historically have not changed in a very long time. Not to say it won't happen, but that should help. That should help keep what we have on the exam current as well.
Okay, thank you. Another question is, will the eligibility to sit for the exam be changing? So Amy, can you answer that?
Yeah, it'll stay the same as it is today.
So no changes to the eligibility.
Nope.
And so can you tell us what the eligibilities are now?
There is a career path and an education path. like there is today. Oh, I lost my train of thought. I was going to say, because I want to bring back the point about this is still a foundational entry level certification. And so, this is this is not an advanced certification, meaning that people who wish to take it that have no experience that are enrolled in a program to complete a billing and coding certification will do just fine. This will not be an advanced level certification.
Okay. And we've got another one. What about inpatient coding and ICD-10 PCS? Will that be covered? Virginia, you could probably get that one.
I sure can. So the CBCS revision will focus on the outpatient and medical office setting. So ICD-10 PCS is noted in the knowledge section of domain 3. I think it's K27, the purpose of various code sets, because we do want to introduce that code set, but we will not be testing on it, and there won't be any inpatient coding scenarios on the exam.
Okay. Let's see. Oh, a lot of questions have come in is, will this be recorded? And yes, I'm sorry, I should have said that during the housekeeping notes. So we are recording this, excuse me. And once it is ready, it will be posted on our website, but you'll also be sent an email with a link to the recording. So that would be great. Let's see what else. Will there be a paper study guide available?
Yes, we will still have a printed study guide for purchase.
Okay.
Online.
Here's a question. Virginia stated that the books the students bring into the exam have notes in them. I encourage my students to write notes in their book. Does this mean if notes are written into the books, the students are not allowed to take the exam?
Yeah, so the testing center that they take their exam the proctor will be looking through those. They're supposed to be flipping through the manuals to make sure that there are no notes or extra material that's been carried in with the manuals. So I don't know, maybe sticky notes or something that isn't quite as permanent on the page that could be removed prior to the exam.
Okay.
And I just want to expand on that just a little bit also. So that's a really good point, and I know that will come through the proctor. But also we've heard from many schools that maybe they share manuals within the classroom. And again, that's okay. Everybody doesn't need to have their own set except to sit for the exam. So we are not saying it's a requirement for the course or your program that everybody has one, but to sit for the exam, they will need that set. So yes, they could borrow them, take the exam, and then return them to the classroom.
Okay. Here's another great question. In the past, the exam was like 80% billing and 20% coding. With the upcoming changes, what are the new percentages?
You want me to flip back to the domain split?
Yeah, that would be great to go to the domain. And that's where I talked about where the billing and coding are almost evenly represented at about 32, 33%. And then the revenue cycle and regulatory compliance, even though revenue cycle is covered throughout the entire process, but that's where the focus is. So yes, that's it.
Yeah, you can see how domain 3 here and domain 4 are nearly even in terms of the number of items that will be represented on the exam.
Great. Let's see. A lot of people have asking again, will this recording go out? Yes, it will.
Another thing that we're going to be doing, so any of the Q&A that might have been put in here that we didn't get to, or other Q&A that we know has come up in our conversations with other clients, we will put into an FAQ document, and we will provide that to your certification specialist. So if you think of something after today, or or whatever, please reach out to your certification specialist and they will be able to help you with anything that you need. And we'll also be able to send to you that FAQ document when it's ready for your reference.
Okay. Yeah, we are capturing all of the questions.
Great.
Some of them are quite specific. So we will answer those and get those back out to you.
Yes. All right. So we just talked about this in follow-up. If you need anything else after today, something else comes to your mind, please, again, reach out to your certification specialist and they are more than happy to help you with anything that you need. Before we wrapped up today, we wanted to share with you what employers have to say. Employees see credentialed candidates as more committed to their career and to excellence. And here are just a few of the large employers that value the NHA CBCS credential today. And I wanted to share this quote with you as well. This is what Physicians Primary Care of Southwest Florida had to say. At NHA, we believe in always being industry advocates with a focus on recognition and the value of certification. NHA's advocacy, sorry, I am not reading her quote. Her quote is, as healthcare evolves, having top certified talent in billing and coding is integral to our success as an organization and as a provider. Being certified with NHA shows that you have the drive, the industry knowledge, and the skill set necessary to grow with us. And that's again from one of our users of the CBCS certification. So what I wanted to end with is that we do believe in being advocates in the industry. And we actually have a team here that's focused on recognition and advocating for the value of this certification. So our advocacy team at NHA would be super excited to spread the news of this new exam with employers throughout the country. So they're actually here to help you by building those strategic partnerships in your area. Building partnerships between educators and employers is what they're here to help do. And so that's another thing, that if you have interest in collaborating with an employer in your area or building a relationship there so that your students can leverage that relationship once they've completed the program, reach out to your certification specialist as well on that, and they will get you connected to those folks. So to wrap up, all of us at NHA want to thank you for your time today. We hope you are as excited about the new CBCS as we are. We're here to answer any questions, guide the transition. We know it's a lot, but we also think it was well overdue, and you're going to really like the new changes. So we'll help with implementing the new study guides and the preparation materials. Just reach out and let us know. That is all we had for today.
Thank you everyone for joining. This webinar is being recorded and a link will be sent out to you when it is available, as well as the FAQ document.
Again, thank you again so much for your time today. We really appreciate it.
Thank you.
Yes, thank you.